Hi everybody, my name is Dr. Zainab, and today I really want to talk about the most common condition that comes into my clinic, which is high blood pressure. So when patients come in and they may have already been diagnosed with high blood pressure, or the reading may have been taken during the clinic appointment, and how I describe it is that it is a measure of how hard your heart is pumping and relaxing. And the reason why we worry, now there's a few reasons. And one of the reasons is if you think about it, if when you're in the gym, for example, and you're working out on your bicep muscle, when you're working on it, it will get bigger and more stronger. But your heart muscle doesn't work like that. If your heart muscle is pumping really hard, causing that high blood pressure over a long period of time, the muscle of the heart will start to not work as well. Along with that, there'll be high pressure blood being pushed around in the tubes going around your whole body from the heart, and that can be quite dangerous and increase your risk of heart attack or strokes. And not forgetting the small blood vessels in your eyes and around your kidneys, which can also be affected by that high pressure in the vessels. And blood pressure is really easy to measure. Now, most of us have the automated machines that can be used to measure high blood pressure or any sort of blood pressure. And obviously this is put around the bicep muscle, and you press the button and it will squeeze your arm, maybe a bit uncomfortable for a couple of minutes, but essentially it's detecting what pressure your heart is contracting or squeezing and what pressure your heart is relaxing. So as a rough guide, normal blood pressure can be seen to be between 90/60 and 120/80. So the top numbers, so the 90 and the 120, are the pressures at which the heart is contracting or squeezing the blood out of the heart. And the lower number is the pressure at which the heart is relaxing. If you are found to have a reading which is a little bit high, whether it's done at the pharmacy, whether it's done at the GP surgery, you may be asked to do some readings at home. So generally we say, 7 days worth of readings, twice a day, same arm, sat down, relaxed, a minute or two between the readings, if you want to do 2 in the morning, 2 in the evening. And what we then do is measure the average of the pressure of the contraction and pressure of the relaxation. So if your average blood pressure is more than 135/85 at home, then that would be considered to be slightly raised. And in that situation, depending on how high it is above that 135/85, the GP can decide whether you need to be on medication or not, depending on your other history, or whether we want to try and think about lifestyle changes and then repeat the readings. Usually blood pressure and high blood pressure does not really cause symptoms. It's usually called a silent disease. However, if your blood pressure is over 180, the top number, or up to 200, people do sometimes describe headaches, blurred vision, dizziness. So if you have any of those symptoms, it's really important to have your blood pressure checked to make sure that it's not that high, because you might need to be referred into hospital for them to monitor your blood pressure while they give you medication and try and bring it down safely. Now, I understand that there are lots of medications that we can trial to help someone bring their blood pressure down. But one of the things that I really want to bring home in terms of messages is how we can help our blood pressure without medication. People actually underestimate lifestyle choices that can really help your blood pressure. Blood pressure increases when your weight increases. So reducing your weight by doing diet and exercise can really help bring your blood pressure down. Reducing salt in your diet, limiting alcohol, quitting smoking, and getting a really good night's sleep. People underestimate stress as well. Stress is a huge risk factor for high blood pressure, especially if it's prolonged. So if you have any symptoms of stress or worry, please see your GP or another health professional to help your stress, okay? I hope you found this video useful. I know that there are a lot of medications that we use for treating blood pressure. If you are someone who already is on medication and you have a query about it, then just speak to your GP or practice nurse. And the same as if you haven't got high blood pressure but you're worried about it, if you've got a high family history, for example, or you've had a one-off reading that's not right, then just get advice, okay? I hope you found this video useful, and I hope that you guys have a very nice day, and catch you on the next one. Okay, bye.